Good morning, class. So, last time we have seen the SAR regarding the adrenergic agents. Along with that, we have seen some examples of adrenergic agents, then the classification of adrenergic agents, how they are classified. So, I will just go briefly through the SAR point, then the classification, then we will move to the next part, that is the antagonist, that is the drug which bind to the receptor or the adrenergic receptor and they will block the activity. Okay, so until now we have seen the agonist. What are the adrenergic agonists? What is the SAR regarding the adrenergic agonist? Okay, now I will just go briefly in small part through the SAR. So regarding the SAR of adrenergic agents, there are two parts regarding the SAR of adrenergic agents. One is the regarding the phenylethylamine. Second one is regarding the nucleus which having the imidazoline ring structure. Okay, so regarding this one, in case of phenylethylamine. So generally, if we increase the bulkiness of a structure or the bulkiness in the terminal amine, then it will decreases the alpha agonist activity and it will increases the beta agonist activity. So here in case of this part R1, if it is hydrogen, if it is methyl, then they will show some kind of alpha activity as well as the alpha and beta activity. But if it increases methyl, then ethyl, propyl, then it will increases the beta activity. And if it is tertiary butyl, it will show the beta 2 agonist activity. And after tertiary butyl, if we further increasing the number of carbons, then it will show the alpha antagonist activity. So this is the regarding the selectivity part. The next selectivity part regarding the phenylethylamine is that this substitution which is present on the alpha carbon. If that substitution which is present on the alpha carbon, if it is methyl, then it shows the alpha 2 agonist activity. And further, if we increase the alkyl part, that is the ethyl, propyl, butyl, then it will decrease the alpha agonist activity and it will increase the beta selective activity. The next part regarding these two hydroxy groups which are present on the benzene ring, that is the cortical nucleus. So these two, if present, they will show alpha activity as well as the beta activity. But if only the 3' hydroxy group is present, it will show alpha selectivity. If 4' it is present, that is the only 4', then it will show the beta selectivity. The next part is that regarding the one of the hydroxy group, it is converted into the CH2OH, it will show the beta selectivity. Or both are the CH2OH, then it will show the beta selectivity. Okay, and if we remove this both the hydroxy group, then it shows the directly or indirectly acting agents rather than the selectivity for the alpha receptor as well as the beta receptor. The main thing is that this structure they having the two hydroxy groups, so they may prone to the metabolism called as metabolism by the enzyme COMT, that is the corticomethyl transferase. So if we are converted them into the CH2OH part, or if we remove one of the hydroxy group, then its rate of metabolism decreases. It will not undergo metabolism by the COMT. Similarly, if the bulky group is present at this position or at this position, then it will decrease the metabolism rate by the enzyme monoamine oxidase. So along with that, this substitution can decrease the metabolism of the drug. Okay, so these are some important parts regarding the SAR of phenylethylamine. Okay, then we have seen SAR if beta imidazoline ring is present. Okay, if SAR regarding the imidazoline. So this is regarding the selectivity for the alpha receptor. So generally, if the imidazole ring is present, they are most selective towards the alpha receptor, or they having the alpha selectivity rather than the beta selectivity. So if this X or the bridging unit, if it is carbon, it is alpha 1 selective, and if it is nitrogen, it is more alpha 2 selectivity. As well as if the chain is open or imidazole chain, we open the imidazole ring, then it becomes more alpha 2 selective as compared to the alpha 1 selective. So these are some parts regarding the SAR of phenylethylamine and the imidazole, due to which the selectivity of drug it may increases towards the alpha or maybe towards the beta receptor. Okay, that we have seen in the last lecture. Next part, what we have seen, that is the classification. So SM means sympathomimetic drugs. So sympathomimetic drugs, they are classified into three types, that is the directly acting, indirectly acting, and the mixed acting drugs. So in case of directly acting, that is the endogenous catecholamines. In that it includes adrenaline, noradrenaline, then alpha agonist drug, then the drug which act on both, that is the alpha as well as the beta receptor. And then selectivity for the beta receptor, they comes under the beta agonist. Okay, so these are the examples of endogenous catecholamines, that is the dopamine, norepinephrine, and epinephrine. So here you can observe, in case of norepinephrine, NH2 is there, so it is more selective towards the alpha receptor. Here one CH3 is there, so it is more prone for the beta receptor. Then alpha agonist, so alpha agonist, that is the phenylethanolamine, that is phenylphyrine, methoxamine, midodrine. These are the drugs which comes under the alpha agonist, having phenylethanolamine in their structure. Then arylimidazoline, that is the nafozoline, tetrahydrozoline, xylometazoline, oxymetazoline. These are the two arylimidazoline rings. Then two aminoimidazoline, in that we includes clonidine. And in case of open ring imidazoline, we includes the drugs, that is guanbens and guanfacine. Okay, so phenylphyrine, you can observe only the one hydroxy, and it is at the third position, so it is more alpha 1 agonist. Then nafozoline, tetrahydrozoline. So these are the structures of this drug. Nafozoline, tetrahydrozoline, they are more selective for the alpha 1 agonist. Then clonidine consists of nitrogen, so it is more selective towards the alpha 2 activity. Then guanbens, guanfacine, they having the open chain imidazoline ring, so they are more selective towards the alpha 2 receptor. Then methyl dopa. The next part, what is the drugs which comes under the beta agonist, in that isoproterenol, it is also called as isoprenaline. Then metaproterenol, terbutaryline, albuterol, pirbuterol, salmeterol. So all these drugs which comes under the beta agonist, they are mainly selective for the beta receptor. Okay, why they are selective for the beta receptor, that we can see from the structure. Here you can observe bulky group at the terminal amine group. So due to the bulkiness, it will more selective towards the beta receptor. Here you can observe, in case of metaproterenol is also there bulky group. Here tertiary butyl group, if tertiary butyl group is there, it is more selective towards the beta 2 receptor. So terbutaline is beta 2 receptor agonist, so generally they are utilized as a bronchodilator. So in case of asthmatic patient, these drugs can be given for the bronchodilator. So from structure you can come to know that why they are beta selective. So why? Because of the bulky group which is present at the end of the structure, as well as the position, that is the position of hydroxy group. Then albuterol, here you can observe pirbuterol, salmeterol. So these are the long chain compounds, as well as the hydroxy group is present with CH2 group. So this indicates these drugs are more prone for the beta selective as compared to the alpha. In beta, they are more selective towards the beta 2 receptor. Colterolol again, tertiary butyl. So due to the presence of tertiary butyl, they are most prone, or they are more selective towards the beta 2 receptor. So these are some drugs which comes under the beta 2 agonist, or they are also called as the beta agonist agents. Then indirectly acting. So indirectly acting, already we have seen directly or indirectly acting. What happens in that structure? If these two hydroxy groups in the catechol nucleus, if these two groups they are absent, if there is no presence of these two hydroxy groups in the catechol nucleus, so such compounds they comes under the directly acting or indirectly active. So here you can observe amphetamine, methamphetamine, hydroxymethamphetamine. So there is absence of catechol nucleus. That means two hydroxy groups, they are absent in their structure. And due to the absence of these two hydroxy groups, due to the absence of this one, they are more prone towards the directly or indirectly acting as compared to the alpha or beta selective drug. So in the structure, you can observe, if there is an absence of catechol nucleus or the hydroxy group which is present on the benzene ring. At that time, the drugs are more prone towards the directly acting or indirectly acting as compared to the alpha selective or beta selective. Then ephedrine, pseudoephedrine that we have seen, they are the isomers of each other. Okay, they mix acting ephedrine, which act by the selectivity also, which act by the directly or indirectly acting. So they can act on the alpha as well as beta receptor, as well as they act on the directly or indirectly way. So they come under the mixed acting agents. So this ephedrine, that is the 1R2S negative ephedrine, it is the most active from all four isomers. सगळ्या 4 isomers मध्ये हा isomer आहे तो सगळ्यात जास्त ऍक्टिव्ह आहे. Now at the end of last lecture we have moved to the next part, that is the antagonist agent. So the agonist means which can bind to the receptor and they will facilitate the activity of the neurotransmitter. What is antagonist? So antagonists are the drugs which can bind to the receptor and they block the activity of the receptor. So if they block alpha receptor, so they block the activity of adrenaline by binding to the alpha receptor. So if they block that receptor, there is no further function of that neurotransmitter takes place. So that is the antagonist agent. That is the effect of antagonist agents. Okay, so there are two types of blockers, or you can say antagonist agent, or you can say symphatolytic agents. Okay, alpha and beta. So alpha blocker or alpha antagonist and beta blocker or beta antagonist. Again, alpha are classified into alpha 1, alpha 2, beta is classified into beta 1, beta 2 and beta 3. So the drug which binds to the alpha 1 receptor and they block the activity of alpha 1 receptor, they called as the alpha 1 blocker. Which block the activity of alpha 2 receptor, they consider the alpha 2 blocker. The drug which binds to the beta 1 receptor and block the activity of beta 1 receptor, they consider the beta 1 blocker. Drug which binds to the beta 2 receptor and block the activity of beta 2 receptor, that is the beta 2 blocker, and they bind to the beta 3 receptor and block the activity of beta 3 receptor. Such drugs comes under the beta 3 blocker. So in this way the classification of antagonists takes place. So symphatomyopathic classification we have seen. Now next part, that is the symphatolytic agents, that is the antagonist, that is the blocker. So they are classified into alpha blocker and beta blocker. Again alpha blocker, they are classified into alpha 1 blocker and alpha 2 blocker. Then beta blockers, they are classified into beta 1 blocker, beta 2 blocker and beta 3 blocker. Okay. Next part, that is the classification of symphatolytic agents or the blockers. So the first class is selective blockers. Okay, selective means they are selective for the alpha receptor or they are selective for the beta receptor. So for that receptor, if they are binds only to that receptor, they consider the selective drugs. So prazosin, terazosin. So this is the structure of prazosin. This is the structure of tolazilin. This is the structure of dibenzamide. Okay, so prazosin is the example of selective blocker. Okay, then non-selective. Non-selective means they can bind to the alpha receptor also, they can bind to the beta receptor also. Such drugs, they bind either of receptor, they called as the non-selective. Again non-selective, they are classified into two types, that is the reversible and irreversible. If they bind to the receptor and after some times they are removed from that receptor, that drug is called as the reversible. For example, this one, tolazolid, phentolamine. So these are the reversible non-selective adrenergic blocker. Irreversible means they bind to the receptor and permanently block that receptor. For example, dibenzamine, phenoxybenzamine. So these drugs, they bind to the receptor and they permanently block that receptor. Again, that drug is not detached from the receptor. So such drugs, they comes under the irreversible. So selective adrenergic blockers, they are producer terazosin. Non-selective, they are again classified into two types, that is the reversible non-selective blocker and irreversible non-selective blocker. So here you can observe the structures of different adrenergic blockers. Phenoxybenzamide, that is the irreversible alpha blocker, then non-selective receptor blockers, they are tolazulin, phentolamine, and they are non-selective. They can act on alpha 1 as well as the alpha 2 receptor. And selective alpha 1 antagonist, that is the prazosin and terazosin. So they are the selective alpha 1 blockers. They block only alpha 1. They will not block alpha 2 or beta 1, beta 2. So as they block or they bind only to the alpha receptor or the alpha 1 receptor, they consider the selective. But in case of non-selective, they can bind to the alpha 1 receptor as well as the alpha 2 receptor. So they become the non-selective. So the tolazolin, phentolamine, these are the non-selective alpha blockers. And this phenoxybenzamine is the non-selective irreversible alpha blocker. So these are the reversible, these are the irreversible alpha blocker. That means they can block alpha 1 receptor. Also, they have ability to block the alpha 2 receptor. So non-selective alpha 1 blockers. So non-selective मध्ये कुठले कुठले येतात? रिव्हर्सिबल अँड इरिव्हर्सिबल. रिव्हर्सिबल मध्ये टोलाझोलिन अँड फेंटोलामाइन. इरिव्हर्सिबल मध्ये डायबेन्झामाइन अँड फिनॉक्सीबेन्झामाइन. So they binds both, that is the alpha 1 as well as the alpha 2 receptor. So to non-selective alpha 1 blocker, there are tolazolin and phentolamine. So this is the structure of tolazolin. Okay, so what will be its chemical name? Tolazolin. So basic nucleus is imidazole. Okay, if here double bond is present, that means it is imidazole, but here hydrogen is present. So what is this? 1H imidazole. That is the basic nucleus. And at second position, so this is first, this is second. So at the second position, there is a presence of this group, vinyl ring with the CH2. So such group is called as the benzyl. So it is 2-benzyl. Okay, are you getting my point? This is imidazole, but missing double bond. So one hydrogen imidazole, that is the basic nucleus. At the second position, there is a phenyl ring along with the CH2, that is the benzyl ring is present. And due to the missing of double bond, so at first position hydrogen is there, so one hydro, and there is a missing of double bond. Okay, so I will show you where the double bond must be. So this is 1, this is 2, this nitrogen is 3, this carbon is 4, this is 5. So in between 4 and 5 there is a missing of double bond. At that time it is called as 4,5 dihydro. So what will be the nomenclature for the tolazolin? It is the 2-benzyl 4,5 dihydro 1H imidazole. So tolazolin, that is the non-selective alpha blocker which can bind to the alpha 1 receptor as well as alpha 2. So it is 1H imidazole. So it is 2-benzyl 4,5 dihydro 1H imidazole. So that is the nomenclature for this tolazolin. So this tolazolin is responsible for the binding to the alpha 1 receptor as well as the alpha 2 receptor. So generally it shows the vasodilatation activity. So it is useful in the treatment of Raynaud's disease as well as the pulmonary hypertension. So this tolazolin is useful for the treatment of Raynaud's disease as well as it is the vasodilator, so it is generally useful in the hypertension. So in case of pulmonary hypertension, to reduce the pulmonary hypertension, the tolazolene drug can be used. So that is about the tolazolene. Then in case of phentolamine, the basic nucleus is the phenol. Okay, so phenol will be the basic nucleus. So what will be the nomenclature? So phenol. Here you can observe there is a presence of benzene ring along with the hydroxy. So that is the phenol ring. So hydrogen, this hydroxy group is 1, this 2, and at third position there is other substitutions are present. So substitution कुठल्या पोझिशनला आहेत? थर्ड पोझिशनला. सो सगळे जे सबस्टिट्यूशन येणार ते ह्या सगळ्या ब्रॅकेट मध्ये येणार. सो फिनॉलच्या थर्ड पोझिशनला सबस्टिट्यूशन आहे. सो ऑल द सबस्टिट्यूशन इट विल कम इन टू द ब्रॅकेट. आता कुठले कुठले सबस्टिट्यूशन आहे? इमिडाझोल आहे, त्यानंतर ह्याला मिथाइल आहे, phenyl methyl group, and here there is the presence of CH2 group. Okay, so what will be the nomenclature? 3 into the bracket imidazole ring है, so imidazoline. Okay, here you can observe imidazole ring, so imidazoline. Then 2 methyl at the second position, there is a presence of methyl group is there, so it is 2 methyl. Imidazoline, then 2 methyl, that is the methyl ring. And at the fourth position there is again another methyl group is present, so 4 methyl, this is phenyl ring, this is amino ring, so 4 methyl phenyl amino. Okay, so 4 2 methyl नंतर परत 4 methyl झाले की this is the phenyl ring, this is the amino ring, so 4 methyl phenyl amino, phenyl and then amino group. ओके, आणि हे सगळं कशामध्ये आलं? ब्रॅकेट मध्ये. सो ब्रॅकेटच्या बाहेर काय थर्ड 3 phenol. So phenol is the basic nucleus, so it is the phenol. At the third position all the substitutions are present, so this bracket, out of bracket, this is the 3 and this is the phenol. So in bracket what will be there? Imidazole, this is imidazole ring, then this is methyl, so 2 methyl, then at fourth position there is another methyl, so 4 methyl, and this is phenyl ring, this is amino, so phenyl amino. So what will be the nomenclature for the phentolamine? So the nomenclature is 3 into the bracket imidazoline, 2 methyl, 4 methyl phenyl amino, phenol. Okay, so that is the nomenclature for these drugs. So nomenclature clear झालं. What is the nomenclature for tolazolene and what is the nomenclature for phentolamine? Okay, so these are the imidazole derivatives, or these are the imidazoline competitive blocker. These are primarily historical interest. The structure of is similar to the imidazole 1 agonist, but they have lipophilic substitution for the agonist activity, so they lack this substitution. So these are the drugs which have in the imidazole ring and they are present antagonists. Why they are antagonists? Because they are in the similar kind of structure, but they having the less lipophilicity, so that it is difficult for them to produce the activity. Hence they bind to the receptor, but they will show the similar kind of effect, that is called as alpha 1 blocker as well as the alpha 2 blocker. And generally these drugs are non-selective, so along with this alpha receptor they are responsible to activate histamine receptor, adrenaline receptor also. So they are responsible to activate histamine receptor, adrenergic receptor also. Okay, so in this way they will perform their activity. So these both the drugs, that is the tolozoline and phentolamine, they responsible for the blocker of alpha 1 receptor as well as alpha 2. Actually alpha 2 is not necessary, but they mainly blocking alpha 1 receptor also. So they are responsible to produce the vasodilation effect. So they are useful in the hypertension. So they are generally useful in the pulmonary hypertension treatment. Then tolazoline is useful in the Raynaud disease. Then phentolamine, it is also responsible for the vasodilation for the hypertension or for the treatment of hypertension. Such drugs can be used. Okay, so generally this phentolamine, that drug, they decreases the sweating also as well as the vasodilation. So generally they are useful in the pre-operative treatment. जेव्हा एखाद्याची सर्जरी करायची असते किंवा ऑपरेशन करायचं असतं, before that such drugs can be given because these drugs are responsible to decrease the sweating also, they are responsible to decrease the vasodilation also. So what happens generally, these drugs, they are non-selective, so they can bind to the alpha 1 receptor, they will block that alpha 1 receptor as well as they will block alpha 2 receptor also. But along with that, as they are non-selective, they can bind to the acetylcholine, they can bind to the histamine and other receptor also. And due to that, there is a chances of increasing the catecholamine nucleus, catecholamine nucleus neurotransmitter. So they may produces they will increases the blood pressure. So for that, it is necessary to give this kind of drug in the pre-operative state. Are you getting my point? So pre-operative state, these drugs can be given. Now, in case of irreversible alpha blocker, so this is the non-selective reversible alpha blocker, that is the tolazoline and phentolamine. Now we will move to the next part, that is the irreversible alpha 1 blocker or irreversible non-selective blocker. So when we call it as the irreversible drugs, so if a drug binds to the receptor permanently, it will not leave the receptor after completion of the reaction. Such kind of things they are called as the irreversible, or such drugs they are called as the irreversible drugs. Okay, so A drug hai to B la bind झाला. Suppose this is the receptor, A is the drug, so they bind to each other and it is difficult to separate, or they are not separating from each other. Generally reversible मध्ये काय होतं, A drug आहे, B receptor hai, so they bind to the receptor. After some times A will be separated, B will be separated, they will perform their function. Drug आहे तो eliminate होतो through metabolism. B is the receptor, another drug, another neurotransmitter can bind to the receptor. So after some times, after requiring the activity, after completion of activity, so drug can be detached or it can be separated from the receptor and they will perform their activity. So that generally takes place in case of reversible. But in case of irreversible, what happens? The drug bind to the receptor and after the activity also it remain intact. It is difficult to, or it is not detaching from the receptor. So in reversible it can be detached from receptor, but in case of irreversible it cannot be detached from the receptor. So permanently it blocks the receptor. Why it is not detaching from the receptor? Because they form a strong bond in between the reactant or the drug and the receptor. स्ट्रॉंग बॉन्ड असेलच तो तरच तो सेपरेट होऊ शकत नाही, बरोबर आहे. आणि तो स्ट्रॉंग बॉन्ड कुठला असतो? दॅट इज द कोव्हॅलंट बॉन्ड. Okay, so in the irreversible alpha 1 blocker, it forms a covalent bond with the receptor. That's why it is difficult to break that bond, hence the permanently blockage of the receptor takes place. So that is about the drug, that is the irreversible alpha 1 and alpha 2 blocker or irreversible non-selective blocker. And for example, phenoxybenzamine. Okay, so I will just draw the structure of phenoxybenzamine. This is phenoxy. This nitrogen. This is chlorine. So this is the structure of drug, that is the phenoxybenzamine. Okay. So what happens? It forms a alkylating bond. So this drug, it binds a covalent bond. Generally, it binds a alkylating bond, or it causes the alkylation of the receptor. So that is the strong covalent bond is present. Hence, it is difficult to separate the receptor from the drug. So how it will form? So as we have studied in the nitrogen mustard case, okay, in anti-cancer, what they are forming the aziridinium ion. Similar kind of condition it will offer, and this Cl, it is eliminated. हा Cl आहे तो निघून जातो, आणि हा Cl ज्यावेळी निघून जातो ते स्ट्रक्चर काय फॉर्म होतं, हा एक कार्बन आणि हा एक कार्बन. सो वी आर गेटिंग द this kind of structure. So nitrogen along with the 2CH2 group. So we are getting the such kind of structure. ओके. सो कुठलं स्ट्रक्चर आपल्याला मिळणार आहे, हे स्ट्रक्चर आपल्याला मिळणार आहे. ओके. So during the nitrogen mustard, what happens? The removal of chlorine was takes place, and due to the removal of chlorine, it was forming a aziridinium structure. So similar kind of structure we can observe. And when receptor comes in the contact, this bond breaks and it causes the alkylation of these receptors. ह्या receptors आहे ते alkylation होतं. And this alkylation of receptor, that is the strong bond, that is the covalent bond. It is difficult to break that bond, and hence the binding to the receptor through this alkylation, through this irreversible antagonist, it is difficult to separate due to the covalent bond. And hence such drugs, if given once, it shows their activity for 3 to 4 days. So as it is the permanent, it causes the permanent blockage of the receptor. Okay, so in case of anti-cancer, what the similar kind of alkylation of DNA was taking place. So similar kind of reaction takes place for this irreversible, and due to alkylation, it forms a strong covalent bond with the receptor. Hence, it is difficult to break. So once we are giving this drug, it can be active for 3 to 4 days. So it is not necessary to give the everyday this drug. It can be active once we are giving it for the 3 to 4 days. So this phenoxybenzamine is generally useful as a preoperative agent in phenochromatocytoma. So the disease, that is a phenochromatocytoma, in that this drug can be used as a preoperative. Okay, because in case of preoperative, there is a chances of increasing the blood pressure. Okay, so due to that, the hypertension maybe takes place during the operation or during the surgery. आपल्याला टेन्शन असतं, भीती असते, त्यामुळे काय होतात, आपले जे न्यूरोट्रान्समीटर सिक्रेट होतात आणि आपलं ब्लड प्रेशर ही वाढायची शक्यता असते ड्युरिंग द ऑपरेशन और बिफोर द ऑपरेटिंग स्टेज. सो हे ब्लड प्रेशर कंट्रोल करण्यासाठी किंवा हे ब्लड प्रेशर आहे ते मॅनेज करण्यासाठी प्री ऑपरेटिव्ह म्हणजे बिफोर द ऑपरेशन this phenoxybenzamine can be given. So it causes the vasodilatation and it decreases the blood pressure. जरी ऑपरेशनच्या मध्ये ब्लड प्रेशर वाढत असेल तरी ते डिक्रीज करायचं काम कोण करतं, सर्जन. सो in case of phenochromatocytoma, as a preoperative agent, this phenoxybenzamine drug can be used. Okay, so that is the mechanism of action of phenoxybenzamine and why it is irreversible. It forms a covalent bond, and the alkylation of receptor takes place, as it is difficult to break the bond. So it is long lasting. It can be last for 3 to 4 days as a active agent. Okay, the next part, chemical name for phenoxybenzamine. Okay, so this is the drug. So phenoxybenzamine, this is the phenoxy. This is 1, 2, 3 propane. This is amine. So what is the basic nucleus? Phenoxy propane amine. That is the basic nucleus. So this is the phenoxy, these three, so propane, this is amine. Amine कुठल्या पोझिशनला आहे? This is first carbon, this is the second, at the second carbon. So 2 amine. लक्षात आलं? phenoxy propane 2 amine. आता राहिलं काय? बेन्झाईल. बेन्झाईल कशाला अटॅच आहे? नायट्रोजनला. सो इट इज एन बेन्झाईल. दिस इज एन बेन्झाईल. त्यानंतर नायट्रोजनला अजून काय अटॅच आहे? क्लोरो इथाईल. ओके, क्लोरीन कुठल्या पोझिशनला आहे? दुसऱ्या पोझिशनला. सो 2 क्लोरो इथाईल. ओके, सो एन बेन्झाईल, एन 2 क्लोरो इथाईल, फिनॉक्सी प्रोपेन 2 अमाइन. फिनॉक्सी कुठल्या पोझिशनला आहे? 1 ला. सो 1 फिनॉक्सी propane 2 amines. What is the nomenclature? What is the chemical name for the phenoxybenzamine? N-benzyl, N2-chloroethyl, 1 phenoxy propane 2 amines. That is the chemical name for the irreversible agent phenoxybenzamine. Okay, so this is about this one. So what it tells? Irreversible alpha blockers, they produce slowly developing adrenergic blocker. It is not overcome by the enzyme. They are irreversible because they form some haloalkyl amines in the molecule, and as like anti-cancer agent they form the alkylation. Here you can observe azithromycin is formed, and it causes the alkylation of the receptor. The nucleophiles, they attach to the nucleophile, and it can bind to this nucleophile and it forms a covalent bond. So that's why it is the irreversible. So it blocks to the alpha 1 as well as the alpha 2 receptors. So examples are dibenzamine and phenoxybenzamine. We have already seen phenoxybenzamine. What is the mechanism of action of phenoxybenzamine, and what is the chemical name? So this is the chemical name for the phenoxybenzamine. Now we will move to the next part, that is the selective blockers. And generally alpha blockers, they are useful as a vasodilation. So alpha 2 blockers are not used. So only the alpha 1 blockers are used. So selective alpha 1 blockers. So these selective alpha 1 blockers, they are also classified into two types depending upon the drug. So the drug which having the zosine in their last part of the name, so that category comes under the one side, and another one which having the osine in their last part of the name. So zosine and osine. So prozosine, terazosine, doxozosine, this comes under this category. So they having the zosine in their structure. Tamsulosin, silodosin, these are the drugs which comes under these parts. That is the tamsulosin and silodosin. So such drugs comes under these parts. So alpha 1 blockers, generally depending upon their structure, they are classified into two parts, that is the zosine as well as the osine. In zosine there are prozosine, terazosine, doxazosine. Such drugs comes under these parts. So while in case of osine, they are having the tamsulosin and silodosin. So these are the two drugs which comes under this part. Okay, so in case of this drug, what is the general nucleus? One minute. Okay, so what is the general structure of this zosine part of the alpha blocker which having the zosine part in their structure? So I will draw. Please draw the structure along with me. This that is the general structure for the drugs which comes under the category which having the zosine in this part of the nomenclature, that is the prozosine, terazosine, doxazosine. So drug comes under the this class. Okay. So numbering start from this nitrogen 1, this is 2, this is 3, this is 4, this is 5, this is 6, this is 7, and this part is the 8. Okay, so there are numbering starts from this nitrogen. Okay, so 1 for this nitrogen, 3 for this nitrogen. So such structure is called as the quinazoline ring. ही जी रिंग आहे, ही रिंग कुठली आहे? ही रिंग आहे, that ring is the quinazoline ring. It is the quinazoline ring. This quinazoline attached to the this ring. This ring is the piperazine ring. And finally it having this part, this is the acyl part. So these are the parts of the structure. So that is the quinazoline. Quinazoline attaches to the piperazine. Piperazine attaches to the acyl part. So at the fourth position there is a presence of amine group is there, and at the sixth and seventh position there are two methoxy groups are present. So this methoxy group avoid the metabolism of this drug by the catecholaminemethyl transferase enzyme. So this is the general structure for the drug which having the zosine in their part. Okay. So out of this structure there are three drugs comes under this part, at the prozosine, terazosine, and doxazosine. So these are the three drugs comes under the this part. So this quinazoline ring is essential for the activity. At the fourth position, this amine group is present. So this amine group is essential for the alpha 1 blocker activity. So there must be presence of amine group at the fourth position. Then this piperazine ring is essential, not necessary, or it is not essential. It can be replaced by other ring structure like piperidine. सो ह्याच्याऐवजी आपण पायप्राडीन अटॅच करू शकतो किंवा सिंपल अल्किल अमायनो चेन सुद्धा आपण अटॅच करू शकतो. अँड फायनली this acyl part is there. This acyl part, it is generally required for the pharmacokinetic property, that is the regarding the metabolism or the duration of activity as well as for the bioavailability. Okay, so this structure consists of quinazoline ring having amine group at the fourth position, which is required for the binding to the receptor. At the center there is a presence of piperazine ring. This piperazine ring can be replaced with the piperidine ring or alkyl chain. And finally at the end of the terminal part there is the presence of acyl group. So this acyl group is generally useful as a pharmacokinetic agents or required for the pharmacokinetic properties like duration of activity as well as the bioavailability. So for that this acyl part is required. Okay, so details regarding these selective alpha 1 blockers we will see in the next lecture. Now we can stop here.